And while the FDA tries to figure out the source of a massive outbreak of cyclospora, we're taking a look at ways you can prevent it for yourself and for your family from becoming infected. Here with me to talk all about the outbreak is 9 News medical and health expert, Dr. Payal Kohli. All right, Dr. Kohli, we've been talking about this for a couple weeks now, and I feel like it's all over the news stations, not just here. What exactly is it? And when you hear about it, does this alarm you? Are you concerned?
So, Sam, cyclospora is a microscopic parasite, and it infects the small intestine and causes an illness called cyclosporiasis, which is really, I remember from medical school, so dramatic because patients can present with what's called explosive diarrhea, severe abdominal pain, fever, fatigue, weight loss. And we're not just talking a stomach bug, Sam, we're talking weeks and weeks of diarrhea. I remember I had a patient who literally went to the bathroom every 20 to 30 minutes.
For weeks?
For weeks. So you can imagine that it can put you at risk for dehydration, for electrolyte abnormalities. Now, the good news is it's very treatable when it's diagnosed early. You get antibiotics and you can clear it up. But it's caught our attention because this is one of the larger outbreaks. We do usually see something in the summer, but to this extent in so many states. So we're really trying to figure out with the CDC where exactly this came from. And perhaps is there a single manufacturer of lettuce or raw produce that's causing this?
Yeah, that's terrifying to find out that it could be weeks and weeks. I mean, especially if you have a family. Is it something that can be contagious or no?
So this is what's interesting about it. So, you know, when you think about stomach bugs normally, like norovirus or what have you, you can spread it person to person. In this case, it does not spread person to person. So it's really when you take in contaminated water or food and contaminate it with human feces. So they really do discourage using, obviously, feces as fertilizer, but even potentially from swimming pools if you take a mouthful of water. Now, chlorine does not kill this parasite, but here's what's interesting about it, that the parasite actually has these oocysts, so these little tiny cysts that have to sporulate for 2 weeks. So if you go to the swimming pool, take a mouthful of water, they're not mature cysts that can infect you. So it has to live on a food surface for a couple of weeks or live in the water for a couple of weeks, then you ingest it and then you can get infected. So we mostly think if there's outbreaks in families that everybody went and ate the same kind of raw produce that was contaminated.
So, okay, so prevention and treatment.
So prevention, you want to make sure to wash your produce. But here's the kicker. Washing doesn't necessarily get rid of it.
So what do we do?
So I'm going to tell you, but if you buy pre-washed produce, that may not be enough. So some experts say to use a brush, but the brush itself could get contaminated. So what I am doing is one of two things. Either you peel off the outer layers of the lettuce, so you're really sort of getting rid of any of the outer layers because that's where it's most likely to live, or preferably, especially if you're immunocompromised, you have kids at home, you have elderly people at home because they can get really sick with it, you cook your food. So you don't eat raw lettuce, you cook it to 158 degrees Fahrenheit, and that will definitely kill.
158 degrees Fahrenheit.
That's right. Yeah,
okay.
That'll kill your cyclospora. So I'm really sauteing my vegetables now rather than eating a lot of fresh salads, which is kind of a bummer in the summer.
It is.
But it's still a nice way to make sure we keep ourselves risk-free because bleach doesn't kill it. And obviously, we don't want to use bleach on our food surfaces. And we know that a lot of the traditional soaps and such also don't necessarily get rid of the parasite.
And then I know you touched a little bit about, I think it was earlier on last week when you talked about that you can get some sort of treatment for it. But what if you just stay at home and you don't get treatment for it?
So I would recommend to most people to get treatment because it does resolve it much quicker. That's antibiotics. Usually they give you Bactrim or ciprofloxacin, and you can need a longer course if you're a little bit sicker, but that'll take care of it. If you don't get treatment for it, we think there are some people who don't ever get diagnosed or treated. It probably will resolve on its own, but it can take several weeks. And again, if you're HIV positive, have cancer, you're older, you're immunocompromised, these are people who are very high risk. So the things to look out for is, you know, and the reason this is such a hard parasite to trace is because it takes about a week on average for symptoms to show up. So it's not like you eat something and the next day you're sick. It can take a week up to 2 weeks for you to start to have some of those symptoms. So it's hard to really trace where it came from, but I would say if you're having foul-smelling, watery diarrhea and you're having it for many days, go and get this test done. You have to specifically ask your doctor to test this because it's not part of the standard ova and parasite stool test.
All right, Dr. Kohli, we learned a lot. Thank you so much. As always, we appreciate you.